Welcome, everyone. Thanks for joining us this Saturday. So this presentation is ABA for everybody. We are going to be addressing some of, let me just hold on one sec. So we are going to be addressing some common myths associated with ABA, and then we are also going to be discussing some basic ABA strategies and what ABA is as a whole, how services typically look, and how to access services across the board. So anyone who just recently joined, we are recording, so we are going to mute and then open it up at the end once the recording is done. Okie dokie. Okay.
We can still see the meeting recording.
What?
It says the meeting is being recorded, so we have to hit continue. We still see that.
I don't see that.
Oh, wait. I got it.
Okay.
We're good.
Just
Okay, so I'm going to start us off by telling you a little bit about COR. So we provide applied behavior analysis and disability services. We offer behavioral adaptive fitness. We have a clinic in Lebanon and Hasbrook Heights, and both have adaptive fitness equipment. And we also provide in-home behavioral services. And a little bit about me. So my experience ranges from early childhood to adulthood, but my expertise is mainly in that transition period to adulthood and vocational skills. I do all staffing here at COR. So a lot of times I'll be the one matching therapists to the client to ensure that, you guys have exactly what you're looking for and what's best appropriate for the child. I also am having a baby girl next month, so that's pretty exciting. And that's just a little bit about myself.
So for those of you who don't know me, I'm Jen Harris. So I'm the VP of Clinical Services at COR Behavioral Group. So I'm a BCBA, but I'm also a mother to a young boy on the autism spectrum. And I just had my second in December. So I started my career in ABA a little over 10 years ago, and I've been certified as a BCBA for 6 years. It'll be going on 7 very shortly. So prior to joining COR, I had worked a lot in residential, both for adolescent crisis, also for adults with disabilities. I've also done in-home services earlier in my ABA career and some school consultation. So working a lot with staff members and working more on the academic end of ABA. But really a big kind of area that I love to focus on is a lot of collaboration with other treatment team members. For those of you who know me well, I do like to branch out, help where I can and try to help, the client. Okay, so just some learning objectives for this presentation. So first, we're going to have a little overview of ABA, what it is in general, identifying those socially significant issues that ABA can address. We are also going to learn about the common ABA techniques and how to apply some of these to some behavioral issues or even just skill area deficits. We're going to look at some of the misconceptions of ABA. For some of our parents who are on the call, you guys know ABA and how we perform ABA, and sometimes it could look a little bit different than what people kind of hear throughout various parents. So then we also are going to talk about how do we navigate the field of ABA. So if you're a new parent trying to get services approved, we will go over different funding sources and ways to access ABA. And then also what a typical ABA session looks like and what to expect in those situations. Okay, so what is ABA? So ABA as a whole is very evidence-based. So we're essentially looking to teach skills and modify behaviors based on strategies that are supported by our research that is done in the field. So a lot of what our strategies focus on are more of social skill development, communication, academics, even some vocational training and self-care or ADLs. Anything with emotional regulation, all of that can be targeted within ABA. One thing about ABA that I think is really great is that it's a holistic kind of approach. You're looking at all different skill areas, whereas a speech therapist kind of focuses just on that communication and that speech component. ABA breaks out a little bit further, and we sometimes take on these roles of supporting these other professionals, whether it's, carrying over certain skill areas, and helping to generalize those skills. So looking at the need for ABA, so we kind of break it down this way. So we're looking at intensity, variety, and duration. So we're looking to see, okay, what does the individual actually need? Is it that they're going to need very intensive services because they're engaging in a lot of behaviors, or there's a very big need for communication, training, what's needed for that individual? And this can always change throughout the lifespan of the individual as well. So if we have a child that starts off needing very intensive ABA, we might fade out our services as they get older, as they start achieving more goals, and the need for ABA isn't as intensive as it was previously. We're also looking at variety. So what does it look like? We have, parent training available. We have the direct ABA sessions. We collaborate with other professionals. So it's not just focused on one-to-one training with the client. It's also training with every service provider that's involved in that child's life. The client as a whole is our child, but also the families, the treatment team members, they're all looped into this process as well. And then duration. So some people say, ABA is great when they're just very young and they're starting out in services, but we know that it could also expand across the lifetime. We have some clients that we work with that are very young, that are either aged out of early intervention services or are even younger than early intervention age. And then we also have clients that are older, adults in the residential setting. ABA isn't just one size fits all, right? It's kind of across the need of the client and the age of the client as well. And the strategies are always modified, adapted based on where the client is at. So we're always meeting them where they kind of fall. Okay. So what do ABA sessions look like? So some of you may know this. For those who haven't really seen ABA sessions in practice or are kind of newer to the field or just trying to learn about it. So typically we have a BCBA or coordinator that oversees the case, right? They're kind of like the case manager in a sense. They're developing the programs, they're constantly doing their assessments, they're making sure that data is being collected, they're analyzing the data, they're making sure that if a client is progressing, we're turning over programs and making the next step in that process. So they look very different across different cases. If there's a teenage client, they may be targeting certain skills. If there's a little one, then they're probably targeting some different communication skills or different social skills, but things are going to look different for those various clients. ABA sessions typically include these 3 or 4 aspects. So sometimes parent training is done kind of on the side, especially for our center-based clients who come in and they have their programs run in center. So program implementation, so very detailed written out goals that we have with certain steps that the clients need to master. So if it's a basic like expressive ID of colors or body parts or things like that, the program is going to say, the client will say these items, these colors, these body parts in response to what's this, or some other form of prompt that we're giving. So those programs are written out and they're included in the child's program binders along with our data collection and our graphing. So our data collection, we usually calculate percentages of how many times the client was able to perform things independently and correctly. So with that data collection, that is then inputted into our graphs. Our graphs are always available. So if anyone ever has any questions, we could certainly scan the graphs and send it to our parents. And that's where you can kind of loop in that parent training component as well. So also, to go with our sessions, we try to provide a lot of reinforcement, especially for those positive behaviors and completion of those skill programs. So we'll typically give them when it's earned, and then they have their own behavior plan, their own treatment and program protocol that's usually worked on during session. So it can last anywhere from even like an hour to 90 minutes to 4 hours at a time, depending on the client's kind of stamina to engage in session for that length of time. It also depends on the client's needs, family availability, and what insurance has authorized. So I know there's been a lot of recent talk, especially for some of the other ABA companies, where they're like, oh, you need to have a minimum of 10 hours per week of ABA. And a lot of parents are like, we just don't have that availability. Sometimes it's not feasible for the parents, although the child may need it at the time, right? They're in school for 8 hours a day, and then they come home, and realistically, you want that child to have that time, that break in between, because ABA can be very, very draining for some of our clients. So just keeping that in mind. And usually within that session time, our last like 10 to 15 minutes is usually where the therapist is recording the data in the graphs. And they may even be working on some case notes during that time. So what does ABA target? So as we said earlier, it targets a lot of skills. So we target anything from motor skills, so fine motor, gross motor, throwing a ball, to are they able to trace? Are they able to make a line on a sheet of paper? Coloring within the lines, using fasteners, so like buttoning, zipping, using snaps, things along those lines. Language, so any sort of communication development, anything from augmentative communication devices to vocal, speech, and social conversations, which social falls a little bit lower on here. Behavioral and self-regulation, so we're working on coping skills, we're working on identifying emotions, expressing negative emotions, things along those lines for self-regulation to tie into behavioral management too. Self-monitoring, so are they able to follow a chore checklist? Are they able to complete a task based on a variety of steps that may be needed, such as like making a bed. Making a bed could be an extremely long process. So for our clients, if we were to break it down into simple steps, allowing them to use their self-monitoring skills of, okay, I did this, check, I move on to the next step, check. And then we also have attending, which we work on. So a lot of, if we're working on like recall programs, if we're working on task skills, so we may present some sort of, either it's an academic task or a leisure skill, and we're checking to see how long they can stay on task during that time. Again, social skills, we sometimes run our social skills groups that offer a great time for them to interact with other peers, and we're there to help facilitate some positive interactions. Academic based, so some of those for our younger learners, those pre-academic skills like sight word ID, color ID, letter ID, number ID, things like that to get them ready going into a school setting. And then daily living skills. So anything from hygiene, grooming. I know for some of our teens, like puberty is a big thing that we target. Cooking skills, cleaning, anything that would help them be independent to live on their own. So then basically we have these common, what we call our dimensions of ABA. They're essentially the characteristics of ABA that we like to target. So one is generalization. So we're looking to see how skills carry over to another environment with other people. Sometimes we have to program separately to teach those generalization skills. Sometimes, we'll hear from some of our parents or some staff that we work with, oh, well, they do it for you, but they don't do it for us. This is where that generalization piece is maybe needed. So we might need to then strategically plan to teach them that generalization, that it's okay to engage in some of these skills with these other people, or it's okay to do it at home outside of clinic time. It's okay to do these things in the community, even though we've worked on it really intensely at home. So effective, we're constantly evaluating the impact of our interventions. So our strategies that we're using, we're constantly evaluating if they're effective, if they're causing changes in behavior or skill development. Technological, we make sure everything is clear as it can be, clear and concise. So when our therapists are implementing our programs or our strategies, they're using things that are how we intended them to be used. Essentially, they're able to carry it out with the utmost accuracy. Applied, so we target a lot of those socially significant behaviors. If they're engaging in a lot of tantrum behaviors out in the community, we're going to target those skills over maybe if they engage in some hand flapping or some like self-talk. So those are going to be our primary targets. We're going to be targeting whatever may impact their ability to kind of assimilate to their community. Conceptually systematic. So we follow the principles of ABA. We are heavily reliant on our literature, so our research that kind of dictates a lot of our intervention strategies. Not to say everything is, there's one set of interventions that works for one child. We always adapt, we modify, but we're still drawing on some basic ABA principles that we've come across. So we're also very data driven, which is our analytics. So we're looking to see if there's some sort of relation with, functions of behavior. We're looking to see if a child, if there's some sort of correlation with certain things that are happening in their environment. So we're constantly taking data to make sure we can assess their appropriate skills. And then behavior, everything that we're targeting has to be observable and measurable. And that's where, it becomes a thin line of when we're working on some of those emotional regulations, dipping a little bit more into the psychology end. And we're just like, hold on, this is going a little bit outside of our competence and our trajectory of where we need to take these skills. We always focus on something that we're able to collect data on, right? We're looking at something that we can see. If we're not able to really see some of those internal processes, it's hard for us to really understand what may be impacting the client's behaviors. So that's typically when we would refer to another professional. So one thing that we heavily rely on is our relationship of the ABCs. So the ABCs of ABA. So some of you may come across where a BCBA or a therapist had been collecting ABC data for your child, or they have asked you to collect ABC data. So it goes off of your antecedents, behaviors, and consequences. Essentially, what's going on before the behavior happened, what was the behavior, and then what happened after. Were they able to avoid a task? Did you end up giving a reprimand when maybe they were alone and were trying to seek attention? So we're trying to use those ABCs in order to help us identify potential functions of behaviors. Okay, now I will switch it over to
Okay, so some myths and misunderstandings of ABA. So a lot of people believe that ABA is only table work, but as Jen had mentioned, there's the whole aspect of generalization of skills, which is super important, ensuring that these skills travel over to their natural environment.
Oh, sorry.
All ABA programs are the same. They are not. All of your ABA programs, especially in your child's binder or the learner's binder, are individualized to that particular learner. ABA is only for children with autism. We'll dig a little bit deeper in a few slides later, but it is not only for children with autism. A person needs at least 40 hours of ABA per week to have an effect. A lot of times it's just not doable. And ABA is simply a fancy name for bribing with toys and food, and as some may have heard, like dog training.
So these are all false. Like Caitlin said, we typically try to work on generalization. We're constantly adapting things to modify our approaches with certain clients. And like I said earlier, the 40 hours of ABA and, the minimum of needing 10 hours. Sometimes, like Caitlin said, it's just not doable, but we are, trying to optimize where we can, especially if the need is there. And the last one is always just hilarious. So we typically don't do bribing. We are very against bribing as a whole. But when it comes to our reinforcement systems, every child has their own different type of reinforcement system. And a lot of the times our kids will work for social praise, especially once we've paired with the client and they enjoy ABA sessions, which we'll get a little bit to later.
Okay, so ABA has been shown to be successful across populations, interventions, settings, and behaviors. And to dig a little bit deeper on all of these things, when we're talking about populations, we're talking about children and adults with mental illness and developmental disabilities. When we're talking about interventionists, we're looking at parents and teachers, staff members, therapists, school staff. And when we're talking about settings, we're looking at, schools, homes, institutions, clinics, group homes, hospitals, business offices. We use ABA all the time. And a lot of you probably use these skills and you don't even know it. And behaviors, so language, social, academic, leisure, self-injurious behaviors, stereotyped aggressions. This is exactly where ABA has been shown to be successful. Okay, so where can we apply ABA? So parenting, you can use this to increase walking skills, language skills, toilet training, household chores. Use that to your advantage. Decrease frequency of arguing, increasing compliance with parental requests. It can be applied in the educational setting, so oral reading and reading comprehension, spelling, handwriting, math, writing, creativity. Also used in the clinical setting, so it's used to help with anxiety, obsessive compulsive disorder, any stress-related problems, depression, obesity, marital problems. Self-management. So ABA can be applied to work on self-control and monitoring, adjusting, making changes for yourself, setting goals for yourself. It can be used in the medical and healthcare setting, so sleep disorders, improving motor skills, exercise, diet, stress management, smoking. Gerontology is definitely something that I would love to get into a little bit more. So compensating for loss of skills, increasing and maintaining ability to function independently. Also the community setting. So controlling littering, increasing recycling, promoting energy conservation, crime. The business setting. So performance management, improving productivity, decrease tardiness and absenteeism, increase sales volume, create new businesses, improve work safety, reduce shoplifting, improve management employee relations. And we can also use it with sports. So improving skills of athletes and motivating practice and endurance training. Okay, so we're going to shift into sharing all different teaching techniques in ABA, but before we go into specifics, it should be noted that all these strategies include these commonalities. So precise definition and task analysis of skills to be learned. Here, we're breaking down larger skills into smaller steps. Direct and frequent measurement of the client's performance. So we are constantly taking data and we know exactly what skills or strategies are being worked on or need to be worked on or need to be modified. Immediate and individualized feedback for client performance. Fading support prompts to promote independence. So we want to ensure that we are fading out more of our intrusive prompts so they become more independent with the skill at hand. So we're not constantly hand-holding, we're kind of fading us being involved and making them more independent. And strategies for generalizing skills to wider settings with other people and non-training situations, which we have talked a lot about. So that generalization of skills.
So,
okay.
Yeah,
go ahead.
Is this yours or mine? So some common techniques in ABA, it includes activity schedule. So we'll dive a little bit deeper into these as the next few slides. We break it down a little bit more. Differential reinforcement. Some of these may be a little bit jargon heavy. But we'll try to break it down as best we can for you guys to understand. Video modeling, discrete trial instruction, scripts, incidental teaching, self-management, task analysis, token systems and reinforcement systems, and prompting. So these are just some basic techniques that we use in ABA that are kind of a wide range of the way they're presented, and they can be adapted for various learners. So activity schedules. So essentially what activity schedules is exactly how it sounds. It's a schedule of various activities that we want the individual to follow and also engage in. Sometimes this helps eliminate a lot of the anxiety with what's coming next, and gives them a little bit more foresight into how their day is going to look. So it may cue them into, you know, what they're supposed to do as far as house chores, when they should access leisure activities, when maybe they need to complete their homework, self-care, and even like meal times. If there's like wake up, it really depends on how broken down you would want the schedule to be. So it might be just morning routine, or instead of morning routine, you may have like brush teeth, wash face, eat breakfast, get dressed, and so on and so forth, whatever your morning routine would look like. So it depends on the child. The goal is to teach them to kind of follow their own schedule without much prompting. So you want them to be able to engage in these activities a little bit more independently. So if you think about it for yourself, you might even create your own schedule, right? On a daily basis, you might use Google Calendar and you have meetings after meetings planned throughout your day. What that does is it helps you keep organized. It's the same thing for our learners that we work with. We're basically teaching them to follow their own schedule, to be on their own, to be able to be functional without much prompting needed.
I've also, with some of my learners, started using like Alexa at this point,
Or
and
Google.
saving that after a while, because who doesn't use Alexa, right? I would never know what to get at the grocery store if I didn't use her.
So this helps kind of maintaining a lifestyle across different settings too. You might include a child's school routine, but also a home routine, and combining it together. It's really just, it helps you guys also as parents, because then you don't have to constantly be prompting. You need to do this, you need to do that, you need to do this, instead of just writing out a list that they would be able to kind of self-monitor. So you're working on those skills incidentally. So when we talk about working on the skills incidentally, it's kind of, we're structuring it to eventually move towards that piece. So then there's video modeling. So for some of you that may not know, we do have a YouTube channel, and we have done some perspective video models. So things like tying your shoe, brushing your teeth, taking out the garbage, walking across the street. All those we have completed, packing lunch, things of that nature that are basic skills. So essentially what we're doing with video modeling is we're recording the behavior occurring. So sometimes it could be done in, we're videotaping the learner and they're seeing themselves do it. Sometimes there's point of view video modeling, which is what most of our ones on YouTube are. So it's basically like the camera is the eyes of the person completing the task. Video self-modeling, so recording the client doing the behavior themselves. The basic video modeling is more of, we might be recording ourselves doing it and then showing the learner. And then we might provide prompting within the video model or along with the video model. So if we're cueing them, okay, this is step one, move on to the next step. Or or we might show the whole and how the child learns best, and we'll approach it that way. Scripts. So we do use scripts sometimes for our learners that we're working on some social skill development. So we may provide just written phrases or sentences, or we might use like the Meyer-Johnson. So I don't know if you guys have seen like the little pictures that people use for like augmentative communication devices. So those pictures sometimes we can use to help support some of the words or phrases if there's a learner who maybe doesn't read well, or they're not used to the sight word identification, but they respond well to those visual pictures. So it cues them into appropriate topics of conversation. It helps work on that reciprocal conversation of, hi, how are you? I'm good, how are you? So they could just provide a little bit of assistance and reminders of how to follow up or what's next in a conversation. So a lot of the times we'll incorporate these with our peers during our social skills groups, or we'll work on them individually first before we work on generalizing it with a peer. And sorry, I think I'm freezing a little bit. So self-management. Self-management is the application of some of our behavioral principles to help guide our own behavior, right? So we're going to pick goals. We're going to, so if, you know, I have to remember to pack up my keys and everything in my bag before I leave the house for the day, I might arrange all my items right by the front door. So I'm like, oh yes, I need to take this, I need to take that. And now I'm set for the day. Also monitoring our own behavior. So making sure, you know, did I do this today? I know Caitlin mentioned the smoking cessation a little earlier on. For those that engage in those types of behaviors, or like nail biting, we might be taking our own data of how often we're engaging in those behaviors throughout the day and trying to work on some sort of reinforcement system. If I don't bite my nails for the entire week,
Sorry, guys.
I may, oh, did I freeze?
You're cutting out a decent amount.
Oh no. What was the last part you guys heard?
If I don't bite my nails.
Oh, if I don't bite my nails for the week, then maybe I'll earn a manicure at the end of the week. Something along those lines. So we're building in our own reinforcement system for some of those behaviors. And like I said, the last part, the administering the reinforcement for ourselves. Go ahead, Kate.
Okay, so differential reinforcement. So this is gonna dig a little deep, and we'll try to make this simple for you guys. This basically means that we're providing reinforcement for desired behaviors while inappropriate behaviors are being ignored or redirected. So the rationale here is that by reinforcing behaviors that are more functional than the interfering behavior, or that are incompatible with the interfering behavior, the functional behavior will increase and that interfering behavior will decrease. Like an example of this could be that if a learner was instructed to point to the color pink, they're only reinforced when pointing to the color pink, and any other response will not receive any reinforcement at all. and discrete trial training. So this is a one-to-one instructional approach, and this is used to teach skills in a planned and controlled systematic manner. So it's used when a learner needs to learn a skill best taught in small repeated steps. And during this process, we're constantly praising, we're constantly using reinforcement for the desired skill or behavior that is being produced.
So this is a lot of the times, and I'm sure you guys have seen this as like the basic ABA. It's like a touch the pig, and the client touches the pig, and then it's like, yay, great job, you touched the pig, and then they move on to another target. So that's when we're talking about like some of the mindset of like discrete trial teaching is only like tabletop work. That's the only thing ABA focuses on. There's a lot more outside of just those structured settings. It is probably one of the most common and is used a lot with our younger learners, but the next slide, Caitlin will dive a little bit deeper.
Yeah, so now we have the complete opposite. So this is incidental teaching. So this is a type of teaching used in ABA therapy that follows very similar principles of discrete trial, but it occurs naturally in the environment. So it's called this for, it's self-explanatory. You're taking advantage of the natural occurring incidents that are already in the environment, and we create them. So like an example could be that a therapist may place a train on top of a cabinet. And when the child points to the train or walks towards the cabinet, the therapist then prompts the client to say train. And once the child does that, they get access to the train. So that was all set up. The train was placed there. So that's an example of incidental teaching.
And even for some of our older learners, if we're working on them with like appropriate social interactions or appropriate greetings, we may, if they're at the center or they're around the house even, we may give them a little bit of a primer of, someone's going to be walking in the door. Let's make sure we say hi to that individual. Or we might just kind of let it play out and facilitate as needed. If they're not saying anything or they're just kind of looking at the individual, then we may prompt that initial interaction. So task analysis. So a task analysis, we're essentially using these to break down some of these complex tasks. So like we said before, making the bed. So we would maybe break it down for a client to follow of, first we need to take the sheets off the bed. Then we need to find the fitted sheet. Then we need to find the regular sheet. Then we need to find our comforter. We need the pillowcases. So, it could be a very long process of, putting the pillow sheets, the pillow covers on, then putting the fitted sheet on, or whatever way they would want to complete the task or whatever they're used to. So understanding that these steps are involved for a bigger whole, right? So they could be broken down to the most simple tasks, or they could be more general. It really depends. So you want to identify these steps kind of in their natural environment to see, okay, where are they missing some of these to complete the whole task? Or can we target this a little bit differently? So, and we'll typically teach it in some sort of logical progression. So we have different methods of chaining. So, are we starting from the first step and moving towards the end? Are we doing it as a total task? So are we expecting them to complete every step in that chain? Are we going backwards? Some kids with like toothbrushing, sometimes we need to teach them to spit out first before we work on the actual brushing. So it really depends on how we think the client's going to learn best. And it may not be that we implement the first chain appropriately the first time we might have to modify our skills because we're like, hey, they're just not catching on this way. Let's see if we change it up, if it'll be a little bit easier for them to learn. Like I said, constantly analyzing and seeing where the child falls. Prompting. So we use various prompt levels. I discussed priming before. So priming is essentially we're cueing the child that something's going to be coming, that we're setting them up that they're going to have to engage in a certain skill. So we have variable prompts where we're like hand over hand helping the child complete whatever it is, especially if they don't know what that like they've never been presented with that task before. Anything from like full hands-on prompts, maybe gestural, so we're just pointing to the object that they need to use for the task. Are we just providing a verbal prompt of let's say it's, they need to wipe down the table, get the spray bottle. That would be a verbal prompt that we may provide. And then we have our, different positional prompts where we may lay things, again, like arranging our environment. So if we know that they need to wipe down the table, we may put the spray bottle and the paper towel on the table. So it cues them into, okay, I need to grab these and I need to spray the table and wipe down clean. So with these prompt levels, we're essentially trying to get the child to engage in these tasks, but lowering the frustration at the beginning. It's like if you're presented with a task, you have no idea what to do. It's like, hey, why don't you go fix this car, right? If we say that and you have no idea what you're doing, what you're looking at, you might get a little frustrated. You might be, why am I doing this task? I don't know how to do it. So we're going to use these prompts to not only just increase the ability for them to respond accurately, but to lower that frustration and have them learn a little bit more effectively. So now that we've kind of gone through some basic strategies, how would we access ABA services? We think ABA is wonderful and we think this will be a great fit for our child. How do I go about getting ABA services? So there are different ways. So COR as a whole is a private insurance ABA provider. We don't accept Medicaid, and we have in the past received funding from schools and also CMO. So essentially, schools will typically provide ABA therapy if there's a necessity within the school district. So they may contract with us to complete something called an FBA, which is essentially looking at the functions of what's causing the behaviors to happen. So they may contract with ABA service providers to get some of those assessments done. They may even want a registered behavior tech or a behavior therapist to work with the child in the school setting for a few hours. It really depends on the school structure and what type of services they have available. They may always contract out. Private insurance, so that typically goes through the parents' insurance typically, where we will submit authorizations to get certain service hours approved. Typically, private insurance can be a little bit difficult at times because there's always going to need to be a clinical justification. Sometimes it may require medical reports. It may require some additional evaluations or whatnot. And then the BCBAs will submit treatment plans to the insurance company to keep services going or to initially begin services. State and Medicaid kind of follow a similar path as private insurance. So ABA services used to be accessed through Perform Care. It has changed since over the past few years. So it's now more so through Medicaid. Sometimes CMO will fund or contract with other outside agencies until a Medicaid ABA service provider is found. That's something you really have to advocate for as a parent, especially if your child isn't accessing any other service through CMO. There are different varieties of services that are available through the state. I won't dive too much into that. If you always have a question, we could certainly talk about that, or you can email if you have any questions. Okay. So questions to ask your provider before services begin. So these are some things that you might want to know about prior to actually settling with a company, right? What's your previous experience working with whatever age your child is? What's your experience working with an 18-year-old client? What's your experience working with a 2-year-old client? You might want to see how many clients they currently have that are within that age group. So you can kind of gear like, oh, okay, they seem like they would have a good grasp then on what they may need programming wise. Are you open to parent involvement and feedback? Do you collaborate with other providers? Is there a lot of parent involvement in treatment sessions? How long do you typically provide services? So are they looking to complete X amount of goals and then be done? Or are they looking to support the child as needed throughout their lifetime? How do you develop generalization of skills? What is the most common teaching style you use? If they're like, we only use discrete trial teaching, then, and you have a client or a child that may be a little bit older, or their abilities don't really match the need for discrete trial teaching, it might not be a good fit at that time. What goals do you believe are appropriate for my child? As part of the team that does intakes, this is one of my things that I do typically at intake. I don't know if some of the parents remembered, but I'll typically review with the parents. All right, what goals would you like to see? What is your top 3 goals that you want for your child? And sometimes I'll even jot down goals that I think might be appropriate for the child and review them with the parent during that intake towards the end of our meeting, based on what I see or based on our conversation. Okay. Go ahead, Kate.
Sorry. So how you know you found the right provider? So your concerns are heard. You are able to be transparent, as you should get positive feedback for being transparent. You have open communication with your treatment team. I believe that, everybody that I work with is more so like family, especially that we're in home. That's imperative. Your provider should be collaborating with other professionals. If you're not collaborating, or if they're not collaborating, nothing gets done. There's no generalization of skills, and in the end, the child and the family suffers. You're seeing progress, but not right away. So progress does not happen overnight. It does happen at, some skills, of course, happen a little faster than others, but progress does occur. Just it's not quick. Your child is comfortable with the individual working with them. You need to have that open communication. They have to feel comfortable. Nothing works if there's no, if your child's struggling with working with that particular provider. So you have to find what best suits you.
One thing to go with that point too is that if you see your child is becoming very resistant to ABA sessions, it might be a conversation that you want to have with your BCBA of, hey, I don't like, it just seems like maybe the therapist won't be a good fit. You've always you know your child best, so you're going to be their best advocate when it comes to determining what's best for them. Is this really the best fit? Could it be that maybe a different service would be more applicable than ABA? It really depends. And a lot of the times, us as providers, we're taking it step by step. It may take a little bit starting out at the get-go to build that relationship, and that's common. Caitlin said, we're seeing progress, but it's not happening right away. We have that old saying kind of across the board of, sometimes these behaviors will get worse before they get better. Sometimes that happens because we're now challenging, they've known, and we're using to session. But I would say if it goes past a week or 2 weeks or something along those lines, you might want to look at if the treatment team is the right fit. If there might need to be some adjustment in maybe the goals, or we need to increase reinforcement on our end. As BCBAs, that's why we look at the data, and we're looking to see, okay, do they need anything modified? Do we need to change our approach? Is discrete trial just too overwhelming for the child, and we need to switch more to play activities, more naturalistic types of approaches? So those are all very needed.
It could also be that maybe your child needs more pairing with the individual that's working with them. I always say to some families, sometimes we're just going to have to eliminate everything that we're working on, no demands, and we're going to take a step into this child's world or client's world, and we're going to do what they want to do. Otherwise, you don't really have any buy-in. So sometimes, even if it's not in the beginning, we all need that step back, and we all sometimes need to revisit these just basics of what the child actually enjoys doing. So that pairing is essential, and it gives a lot of buy-in, and programming could go much smoother if you kind of revisit those basic skills.
And pairing isn't just at the onset of our first few sessions with our clients. We're consistently doing pairing throughout the child services. We constantly want to make sure that we also serve as reinforcers, that they enjoy being around us and they enjoy working with us and putting in that time, and we do get that buy-in. I have some older clients that I work with that there are some days where we'll spend maybe a little bit more time playing games, a little less on the programs, just to build in some of those natural social skills without the structure, but then also to work on some of that pairing as well. It's so essential, even as parents, right? We need to pair with our own children sometimes. Sometimes we get caught up in, they're being good, they're not really causing much of an issue, they have what they need, but they may be looking for that social interaction and that attention. And sometimes a little bit goes a long way in that aspect. So you want to make sure that you're targeting some of those skills, especially I'm kind of speaking from experience because now I have my son with autism, but I also have now a newborn that requires a lot more of my attention. So I have to be very cognizant of how much attention I'm giving to the baby, and also making sure that he knows I'm there for some of his needs as well. So trying to balance that is sometimes a little difficult, and especially for those of you who have other siblings in the picture that require a lot of attention as well, you sometimes feel guilty that you're pouring yourself into one area and not giving some attention on the other side. Or maybe you have one child and you're just busy with work and it makes it difficult. And and you're human and you're a parent, and sometimes things do get very like heavily burdened on you, and you're having to manage and deal with a lot. We're not here to say, you're not doing it with your child, you need to make sure you're doing it, but just being more aware that that might be a component of some of those behaviors that you're seeing in home as well. All right, so we are going to stop the recording and we will open it up for questions, comments, concerns, anything along those lines.